Welcome to Empowered Voices, Recovery to Resiliency.
Yay, welcome, welcome.
I'm Dr. Farzad Kamyar, joined by my wonderful co-host, Miss Amani Wilson.
Yes.
Before we begin today's episode, a little bit of a special flair. We want to provide a content warning. Not to say that what we normally discuss isn't, right? But this episode discusses human trafficking in addition to substance use and trauma. While we approach this topic with sensitivity and respect for survivors/victims, victims-/survivors, the subject matter may be difficult for some listeners. Today, we're addressing a critical and often overlooked topic, the intersection between substance use disorders and human trafficking, with a specific focus on Nevada. Through expert insights and compassionate discussion, we'll explore how substance use creates vulnerability to trafficking, how traffickers use substances, drugs as tools of control, and the specialized support survivors need to heal from both trauma and addiction. It's a difficult conversation, but an essential one. Our goal is to increase awareness, reduce stigma, and connect survivors-victims all the way around as well with pathways to help.
Yes,
Amani.
yes. And joining us today are two distinguished guests whose work is making a real difference in our community. First, we have Ms. Jhenna Strasser, manager of the Southern Nevada Human Trafficking Task Force with the Las Vegas Metro Police Department. Jhenna leads the collaborative efforts of law enforcement, victim services, and community partners to combat human trafficking in Southern Nevada and support survivors on their path to freedom and recovery. Thank you so much for all you do.
Thank you.
We also have Caspian, Miss Cassie Matthews, with us. She brings more than a decade of experience in anti-violence work and victim advocacy. Cassie serves as outreach director of the RISE Anti-Human Trafficking Program at Signs of Hope. She provides human trafficking-related training to a broad range of professionals, including law enforcement, hospitality and tourism partners, medical providers, victim service organizations, educational institutions, and other businesses and community members. She is also an active member of the Southern Nevada Human Trafficking Task Force, where she proudly co-chairs the Victim Services Committee. Thank you both for being here today for this critical work that you do. Thank you so much.
Thank you.
Yeah, awesome. Okay, so to get us started, I'm going to go nuts and bolts. What is this thing known as trafficking?
Yes.
Yeah.
Let's go, Jhenna.
Yes.
Jhenna, why don't you start us off?
So human trafficking is made up of two different types. So there's sex and there's labor trafficking. Both need kind of three elements when it comes to law enforcement specific. But basically it's force, fraud, and coercion. So it's either forcing someone. It looks like physical kind of force. That can look like abuse, sexual abuse, physical confinement. The fraud is often the false promises. So it looks like the promise of a better life, for better money, for love, community, marriage. And then that coercion piece, which is the most common piece that we see, is the threat of something. So the threat to hurt your family, your children, threat to call work and let them know what you're doing. And with that, it's to force them to do, or to exploit them to do things like labor services or sexual, commercial sex acts. So those are the two types. That's kind of the nuts and bolts that you were talking about.
And it sounds like those are the most common. Is there one that's more common than the other?
I wouldn't say more common. I think the one that's more popularized in media is sex trafficking.
Got it.
Labor trafficking is something a little newer and something that we're slowly learning and getting our feet wet in. And so it's something that we haven't really talked about, but also investigated. So it's brand new. We don't know how often it happens, but as we learn and grow, we're getting more familiar with it. There are more cases as we see.
What are some examples of labor trafficking, if you don't mind me asking?
Yeah, so the ones that we've seen so far are either through the restaurant. So a very specific example was a uncle trafficking his niece. So basically using physical force, so physical and sexual abuse, to make her work. And she was 15 at the time, working in a restaurant. More commonly, it could be maybe in the beauty kind of areas. So we've seen it happen in massage businesses, in nail salons, things like that. But it can also happen in other businesses like construction. So those are the ones that we've seen so far, but there is an abundance of other places that this exploitation can occur.
That can
I can
occur.
imagine. And you said this was new, like about how new, honestly?
Not new as a crime, but new. We had a recent team that started investigating it. So this new squad has been up for almost a year now, but we have been investigating it maybe within the last 2 years. So that's how new it's been to our section.
Yeah, super new. I mean, to me,
Yes.
that's super
like,
new
that's
in the
baby
world
new.
of
But what we know a lot of times too is that those who experience sex trafficking usually always experience labor trafficking because they are having to work in a capacity. They are not given like labored workers' rights, right?
Yes.
So all those things are taken away or exploited. So they don't have PTO or benefits or 401ks or sick days, or they're not even getting the wages that they technically earn.
Got it.
And so we can have a lot of times, as we speak about intersections, those two things intersect heavily. So usually where there's a sex trafficking case, there's a labored aspect to it. But then we can also, just like Jhenna mentioned, have labor trafficking on its own, which a lot of times is more prevalent, but just like she mentioned, is still a little bit more difficult for us to be identifying. And kind of getting within those community spaces to build awareness and education about labored rights to make sure that individuals aren't being exploited and then maybe more susceptible to them being trafficked.
Yeah. Okay. Jhenna, you had mentioned some industries when Amani had asked for examples. That sounds to me like something common maybe across the U.S. Is there anything specifically that makes Nevada particularly unique, or it's more prevalent here because we have more of X, Y, and Z, even though other states do? Anything like along
Definitely.
those lines?
I think tourism is a huge influence, and also the ability to travel. We have an international airport. We have also just these large events that bring a slew of people who are coming in, which is an opportunity for traffickers to not only exploit individuals, but also to give into the demand. So trafficking is a supply and demand model.
Supply and demand.
So with those who want to purchase sex, they have to supply the individuals who are being exploited. So with these kind of large events that we have every weekend, or large conventions, things like that, it's just a matter of population that has an opportunity for those transactions to occur. And then we also have kind of the legalities that we have here. In certain areas, in like smaller populations, prostitution is legal, but most individuals do not know that. They think that it's legal everywhere, and you know, with Vegas, they think, okay, buying sex is legal here, when it in fact is not legal in Clark County at all. So we train all the time at casinos, and all of them say that a lot of individuals go up to them and say, hey, where can I get a girl? Or hey, where can I purchase sex?
Thinking that it's illegal.
Is legal here, yes.
Okay. Yeah, that makes perfect sense. Supply and demand. Okay, you know, something, I was at a dinner last night, and apparently there's a mega tech conference starting today, where like every hotel room, every convention center space or whatever is booked. So is there any, from like in an enforcement side or a monitoring side, where you all are looking at trends like this? Because you said it was supply and demand sort of related. So knowing, well, there's all this demand coming in, I guess.
I'm curious.
And is that now correlated to number, prevalence,
It's a
incidents?
it's a little difficult because we have events like that every day,
Every
every
day.
weekend,
Yeah, every day.
so
Okay.
it's like I said, Vegas is very unique in that we can't exactly pinpoint one event to increase trafficking at all. It just doesn't happen that way. It's because we have it so very often.
Got
I
it.
got you.
Okay.
So that was going to be my question. Were there any type of protocols for like maybe even like mega large events, like what is that, EDM? Or some, you know, the bigger, large
There's so many. But
Right.
yeah.
Which one, girl?
Right.
Okay, but you had mentioned the like legality versus illegality. Is there any difference? Just because something is legal, does that mean that we don't see these things?
No.
No.
And I mean, as you can see when we were talking about kind of the places that we see trafficking in, those are all legal places, you know? Massage businesses, nail salons, construction, those are all legal as well. And it's just what traffickers do to facilitate illegal activities is under the guise of this
Under
is
the guise.
legal.
Yeah. Okay. Common misconceptions. I mean, prior to sort of looking at and being vested in because it's affecting our, so, Amani and I with Empowered Program, Roseman College of Medicine, other work that we do is substance use, right? But then substance use also in the perinatal sort of population demographic. There's absolutely overlap. So that's kind of how it entered my world and into my forefront. Otherwise, it was exclusively media, right? Exclusively media. So if that happens to be places where misconceptions are held, but what are some common misconceptions? And for this one, let's have you start off, Cassie.
Oh, there's so many.
Yeah. Let's go top 5, whatever.
Jhenna, help me out with top 5.
I think with social media and even like movies and things like that, people often see, I don't know if you've seen on like those TikToks or Facebook where there's zip ties on the cars or tissues on the cars and everyone's like, this is human trafficking.
Car seat
Yes,
in Target parking lot.
I just seen one yesterday.
Sorry. Wait. What? If there's zip ties on a car?
Yes.
Or someone's windshield wipers was one the other day where they came out to their car and were on TikTok and the windshield wipers were up. And so they automatically equated it to trafficking.
Like being targeted for trafficking.
I saw one with a water bottle. They had it under their tire, and somebody equated that with human trafficking as well, which kind of scared me.
And so we don't ever want to say that those things aren't suspicious. Like we always encourage situational awareness. If you walk out to your car parking lot and something doesn't feel right, please be cognizant. Please be safe. Maybe you can go back inside, all of those just general practices. But what we know, and kind of to Jhenna's point, is that the kind of number one myth is how does trafficking happen? And while we do have a very unique landscape, some of the industries that Jhenna mentioned, all of our survivors don't necessarily have those as their stories. They are someone that the person knew.
Really?
And it does not have to be someone that you've known for a long time. It could be someone, I know we were talking kind of before the show started, somebody that just met that provided you a meal. And then maybe that person comes back the next day to where you're located at, whether it's a school or you're outside of a shelter or wherever you may be. And it's someone that is, again, gaining access to you by giving you something that you are in need of. False promises, basic needs, but it is someone that is known. So most, if not all of our survivors at one point or another have had some sort of an intimate relationship with their trafficker. It's their parent, it's their child's parent, it's their spouse, their partner, their neighbor, their employer, their their community member. It is someone that is known to them. And so unlike movies, a lot of times like Taken or some of these other kind of movies that do paint some things that do happen to some of our survivors, that may be some of their stories. Predominantly, that is not how they are being entered into or engaging within trafficking.
Gotcha.
Okay, I really thank you. I really like this because fundamentally at a subconscious level, it helps as, and we'll get to this, right? How do we look for and whatnot? But it seems like it would be much more challenging for someone to, say, divulge or enter into the world of whatever that looks like when it's someone that they've known and have this relationship with versus an absolute stranger. Okay, all right, cool. We'll get to that. And I want to sort of get to next, like this intersection of substance use and trafficking, yeah? But before that, you both are part of the Southern Nevada Human Trafficking Task Force, yes? Give us, what do you all do?
Yes, I know.
Let's spend some time.
So the task force is made up of both governmental and non-governmental agencies. We have about 16 non-governmental and 13 governmental. And we work together on all things anti-trafficking. So whether it be investigations, prosecutions, or direct victim services. We also do outreach and training. We do everything that you can think of. And really what it's about is a collaborative effort between all the agencies to help in any way possible on any side of the spectrum. So with that, we have about 4 different committees. So we have committees that focus on victim services, on the education piece, on case discussion, so making sure that no one falls between the cracks, that everyone's communicating on those cases.
Love it.
And then our labor trafficking committee, because it's so new, we want everyone who's anyone to be on that to make sure that we're learning together as a community. So that's kind of it in a nutshell. I don't know if you have anything to add with that, but okay.
Yeah. We again, like Cassie, you mentioned, we were talking about before the show about this. My understanding, what I walked away with, was that you all are the all-encompassing collaborative umbrella that covers the state and is like the go-to, which admittedly I wish we had for our substance use efforts.
Right.
This one, we are collaborating with all sorts of agencies. Everything is available in-house for all those partners.
Yes.
An all hands on deck approach, because it's so needed. And there's, yeah. Okay, cool.
One day soon, though.
Yeah. What do we say? It takes however many years?
Yeah, right.
Yeah. Okay, perfect. Thank you. All right. So now our viewers and listeners sort of know what y'all do in that respect. I know I'm showing this much. I'm showing a 3 millimeter sort of bar here for measurement, but I know what you do is sort of infinite through the roof. So yeah, thank you for that. Okay, substance use. Yeah, substance use. Go. I mean, there's a lot of questions I can ask, but just give us your gist. What's your understanding? What do you see in the field, in the world of circle diagram of substance use, circle diagram of trafficking, and what does that Venn diagram look like, if there even is an intersection?
Yeah. I kind of, in preparation for this, I sat down with our case management team, and again, I do some of the direct services, but not as hands-on as what they interact with their clients kind of day in and day out. And so I kind of sat down with them and just said, hey, give me some examples of some things that you all have seen. What are some of the struggles your clients, where does this intersection kind of lie? And honestly, for us, a lot of times, substance use is not something that is at the forefront of most of our disclosures. It's more so with regards to mental health, which then again, there is obviously intersections between those two things. And utilizing substances to be able to cope with trauma, to be able to cope with their victimization, whether that was something that they entered into as kind of a part of their victimization, something that they were then introduced to by potentially a trafficker or in the type of subculture. So I would say from that, they kind of collectively said that if someone disclosed to us, usually about 90% of the individuals were utilizing THC, again, as probably what they would say as a method to be able to cope with anxiety or depression. Yeah. But we've had plenty of cases where individuals, their substance use might have been something a little bit more significant.
Sure.
Those things might have been really affecting kind of their ability to move through their resiliency journey, whether they we've had individuals that were expecting mothers and maybe at the time didn't know that they were expecting and still utilizing substances. And at the time they found out, some continued forward and some went ahead and said, I'm not going to utilize anymore. Some of those also, again, at the end of their actual delivery, then maybe had, unfortunately, their kiddos that now tested positive to something and were maybe now taken away, or they were now undergoing reunification or whatever the case may be. So there's a lot of these kind of intersections and complications that our survivors face. It's not, I think one of the other myths a lot of times too that we find from the general public is that everyone, again, has a perception about those that experience trafficking that they all utilize substances or they all have been branded or they all have been bound and chained. And while some of our survivors have certain of those aspects, not every single one does.
Yes.
And so I've worked with survivors that, for instance, they were previously like on their own sobriety journey working through like Matt and met the trafficker at the time and was incredibly supportive of her working towards her sobriety in that and would drive her regularly to the clinic to obtain that medication and that treatment up until the point that he started trafficking her and then would utilize that as the way as a coercive tactic, causing withdrawal to be obviously very painful, potential relapse, all of those things that she was really striving towards. Utilize that because that was the vulnerability that she had and that he had come in to know about her and then was able to then say, okay, well, if you don't do this, then here's this. Or we've had individuals that have had their spouses maybe that actually were the ones who utilized substances and then would exploit their partner to be able to then get the substances that they needed. And it wasn't necessarily the person who was then being exploited. So there's just kind of all of these different scenarios or minors that have been introduced to substances by a trafficker, and now they're 15 years old and working through, some of them through their own like recovery journeys, and some that are not. So there's a ton of intersection when it comes to it, but a lot of it is not as prevalent, or at least is known to us. We always discuss like harm reduction, and have those conversations with each of our clients so that they know that we have those materials available, or how to access those, how to use safely, all of those types of things.
I'm curious because I know this is kind of like a hush-hush conversation, hush-hush topic, but I know in the substance use world, we are starting to, we have like services, especially services like Empowered, that really do that wraparound. But if somebody was trafficked, what would be their first step into reaching out, honestly?
Yeah. And so again, we are not the specialists when it comes to substance use, right? So we have to do this kind of in a collaborative space with you all and other medical professionals, because we just don't have that level of care. Our piece can come as those additional wraparounds. So the things that you may all not have available to you, maybe it's something that we do. And so that you all can address kind of the niche area that you all are the experts in, or that support is who's needed kind of at the forefront. And then we can work at the others, whether it's, again, specific counseling services that are for individuals that have experienced sexual violence or trafficking. Those, again, are very niche kind of experiences that maybe having a designated therapist who can address those while you're also working through your own sobriety and recovery can kind of go hand in hand. If our case management, if we can also additionally offer you something like shelter or relocation, or just regularly having access to food and basic necessities, then you're not maybe having to look elsewhere or try and figure out, well, what do I have the ability to make my ends meet with? And I think that that's how we can kind of, again, in a collaborative space, it's the only way we can do it, because we're not the experts in that space, but we are happy to be the support to anyone who is, and anyone who's enduring kind of any part of that.
That is so awesome to hear.
Yeah. Going back to sort of what does that look like? What is the intersection from like the medical side, when we look at our, sort of metrics or data or surveillance, studies, I sort of have boiled it down to if you're using substances, then you are at increased risk of.
Absolutely.
I'm not going to say it's 100%, nothing like that. But you're at increased risk of. And I believe what we also find is that if you're involved, or if you're a victim/survivor, you're also at increased risk of substance use. So, yeah, versus like 100% of, it works both ways, those kinds of things. Yeah, absolutely. Thank you. When we touched a little bit about this, but what are some common barriers that individuals experience, not only when they're being trafficked, but if there's unique ones where substances are involved and you're being trafficked, but it could be mutually exclusive as well. Barriers to seeking help. Stigma, number one. These are such recurrent things. Cassie, look, I'll tell you, what you were mentioning, we sort of call it social determinants of health, SDOH, and it obviously comes up as well here. But sorry, go ahead, stigma.
So substances are stigma with substance use, stigma with trafficking, stigma with experienced domestic or sexual violence, stigma with experiencing anything. And that is what we hear from all of our survivors. Maybe that they tried to disclose once, whether it was to law enforcement or a medical professional or victim service provider, and it did not go super well for them. There was a reaction to what they said. They were not believed because maybe there was a disclosure, or they assumed that the person utilized substances, or that there was mental health involved, and they kind of write those individuals off. And so that happens one time, and the likelihood that that window of opportunity is going to open back up again is very, very limited. And so that ultimately is why most of the time survivors say that they didn't come forward, or it delayed them significantly until it was kind of at the end all be all, and it was either the last kind of ditch effort for assistance, or someone actually made a big enough kind of leap and impact to build rapport, and to not kind of have those presumptions or assumptions that the person then said, okay, I'm going to kind of come forward with this, and I'm ready to be able to kind of engage with you and share some of these things.
And traffickers also feed off this. So they use that as saying, like, see, I told you not to trust the police. See, you did these drugs with me. I helped you with this, and you are now a co-conspirator to my crimes. That's what we see a lot on the law enforcement side, is that they don't want to come forward because they feel like they're also an offender. They feel like the trafficker has said, I'm going to bring you down with me. And that's the other piece too that we find is a huge barrier, is the coercive piece.
And they've committed crimes, right? So we talked about some of the things, again, within our statutes here. There are some of these illegal activities. Also, we have a intersection with those that experience trafficking that also are being forced to engage in like drug trafficking. And so they are committing crimes. And so if they went to law enforcement, how do they necessarily know that they won't be held to that for disclosing something? Or for us, we talked about kind of mandated reporting. I mean, there's so much distrust about service providers against, you know, CPS, state, all of these entities, that why would we assume that they would trust us further?
Yeah, I love that as a take home. Yeah, we asked you a question and the first word out of your mouth was stigma. And that's this notion of this like negative connotation surrounding something, right? It's, tangible maybe, but also maybe not. And it's amazing. We bring it up often, this notion of stigma. But I want our viewers and listeners to take this message home, is that something like stigma is preventing individuals who, I'm just assuming, are experiencing something fairly negative, horrible. Yeah. And that is so powerful that it overcomes this, whatever, all the stuff that it takes to seek help. So, yeah. I see this in the media oftentimes. It's 3 years later. Why now?
Yes.
So and the fact that it's 3 years later somehow invalidates. Oh, it must be fake, I guess, and it didn't happen. And with just that one word stigma, I can't go through the infinite variations, right? That had this individual arrive to 3 years later. There was 900 variables that came together. And stigma is probably a massive part of it.
Yeah, that I think is just self-identification. So we know from especially those that experience trafficking, kind of all forms, self-identification and self-reporting is incredibly low. And so it may be that in 3 years, individuals may have removed themselves from a situation, may have maybe sought some sort of therapeutic aspect, and are now kind of working through the things that they had to endure and that they engaged in that maybe wasn't their choice. And understanding how consent works and understanding how the laws work and understanding that just because you committed crimes, this idea of forced criminality doesn't mean that you are now, again, barred from being able to access law enforcement and make a report for a crime that was actually committed against you. Or you're able to qualify for resources and supports because it's not for somebody else, it's for entities and individuals like yourself. And so I think between that and the self-identification, individuals just don't self-identify. They're seeing the same myths in social media things that we are, and in the news, and the sensationalism. And so when they all have social media and they see the same TikToks and Facebook posts, they think that's what trafficking is, and that does not align with what they've actually experienced.
No, honestly, you think trafficking is a kidnapping per se, and sometimes a lot of people don't realize that you were being manipulated, and such a heavy conversation.
Yeah, totally. And
really
we'll get to
is.
that like asking part and how it sort of overlaps. But for me, take home is if someone tells you something,
Listen.
Just listen.
Listen.
Just listen.
Like, it really broke my heart to hear about when you were saying that some people, if that window of opportunity, which is so true even in the substance use world, like you might have one chance, but that's about it. And like you said, taking 3 years, just thinking that that person is just going through all of this alone, trying to figure out what's going on or how to even start with help, and just thinking about all the other barriers, like you were saying, the law, criminality, you know, the criminal aspect of it. It's just so scary.
Yeah.
And it's sad. And we all need to be aware of like what to look for.
Yeah. And that's where I want to go to next. Like sort of what do we look for? And then when we see something, what should we do? But before that, in this world of there is certain things, risk factors, et cetera, and what are some of the barriers that individuals face? Is there anything that pregnancy then complicates? Like, does pregnancy complicate the picture of seeking help more?
Sure. I would say a good majority of the individuals that we engage with have kids and maybe multiple kiddos. And so that has now a connection potentially if that child's other parent is the trafficker, has been their partner, spouse. There may be legal complications to trying to go through criminal proceedings, custody cases, divorce, other civil proceedings that they have attachments, and those attachments are really difficult to try and break, even for safety purposes of maybe mom and for kiddos. And so not only that, it's being able to thrive. Its cost of living here is incredibly high. There are not enough resources in the community or housing available for individuals. Even us being able, when we maybe engage with law enforcement and come in contact with, say, a mom that has even multiple kiddos, trying to put them safely in shelter spaces or hotels before relocation is difficult. They may have to have 2 rooms, but they have 5 minor children. So who gets to, that we can't have them stay by themselves, and shelter may not have capacity for all of them, nor may it be the safest, best place for them. And so there's a lot of complications with mothers specifically, and just kind of that regard.
And I mean, a lot of the times what we see with that coercive piece is that mothers are going to say, I'll keep going through this as long as my kiddo is safe.
Yeah.
I'll keep going through this as long as someone I love is in safe hands, because traffickers do utilize that. And we've seen it. We just had a recent case where the trafficker said, if you come forward to the police, then I am going to hurt your family back home. And when she did, they had set the house on fire, and he made good on his promise. And then the individual was hesitant to come forward again. So there's this very violent, coercive piece, but a lot of the times it's what would you do for the person you care about, for the person you love.
Yeah, one of the heartbreaking things about this, and then we'll move on to sort of the signs, for me is I'm obviously in a super privileged status, right, and position. A lot of what makes up my life and what I do and my motivations are for there to be positive things to happen. And everything that sounds like the majority of things that I'm hearing is that these individuals, a lot of the decisions they make are to prevent horrible things from happening. And I cannot imagine what that state of being would be like.
It's just survival.
Yeah.
It's like pure survival. Okay. All right. So I think help is probably something that is positive. And you can approach this from the field of healthcare, right? The medical system, but individuals, family members, friends, support networks. What do we look for? What are those signs, symptoms? But let's call it signs of someone is in this situation.
So I think we've kind of shifted our perspective to focusing on the vulnerabilities. So trafficking comes down to exploiting a need that is not there. So like we were talking about earlier, whether it's food instability, housing instability, a lack of love and care in the household, these are the kind of things that traffickers look for to exploit. So when we're looking at individuals, we want to look at the whole picture. We want to look at kind of their lifestyle, what are the things that they're struggling with, and what are they telling you that they're struggling with, and what is being exploited there. So that's kind of how we've shifted, because it's very difficult to say bruising is identifying this, because bruising can be domestic violence, it can be human trafficking, it can be all these things. But if we're listening to someone who says, I have to pay a debt, and it's some increased debt that's 80 grand, because we've had a victim in the past that has said, the trafficker says, I owe him 80 grand. That's something that's kind of like, okay, that's kind of a red flag, gut feeling kind of thing. So we always say, trust your gut. If something feels off, it probably is. And then to, just like you said, listen to the story, listen to what is happening that might be exploited in their case.
Yeah, and from, in the world of medicine, we oftentimes try to take this, what we call evidence-based medicine approach or evidence-based practice, right? Research, and then stuff happens based on that, right? Guidelines are recommended and whatnot. And in the world of mental health specifically, we have basically questionnaires. Yeah, we have questionnaires that we use, and that's where we implement it in practice. For example, specifically for, let's say, the adult population, and even more specifically for pregnant individuals. When they come in to obtain prenatal care, we ask them 5 questions about substance use. And that's like our evidence-based screening for substance use. I've come across a couple tools for, I think it's adult human trafficking. And it generally is like, first of all, do you feel safe? Have you ever sort of had this withheld, or have you ever been forced into X, Y, and Z? Can you comment a little bit about those? Now, my understanding is that there is not maybe a gold standard tool, but again, I'm not an expert in this field. So if there's anything that you could recommend along those lines for us professionals to use.
So funny that you mentioned that, because we're actually working on one right now.
Yeah.
Because medical professionals ask us all the time, what is a gold standard screening tool?
Yeah.
So we are actually kind of utilizing one right now where it has kind of what to look for. And it's not so much a questionnaire as it is an observation. So it'll say very explicitly, do not ask these questions, but do you see these things? When you're asking just normal kind of medical-based questioning.
Did they mention these things?
Yes.
Got it. So this is a shift from my understanding. I like this.
Yes.
There's a lot of other great, what we've done is we took all of our expertise from everyone from the task force that, and Jhenna has mentioned, come from all different nonprofits, all different governmental organizations, all different experience levels and interactions, and we sat them all together and went through and then looked at other tools. Like, we're not trying to recreate something. We're just trying to make it applicable for what we know, what we see, what could be helpful, what can just be a guide. Because we don't, just like Jhenna mentioned, we don't want to treat people like check boxes. Because I can take the 10 calls that I received in a week's time, and none of them will be the same. There may be some similarities, but if we were to then try and do a general screening tool, people are going to miss those individuals because it doesn't check those normal boxes. It doesn't look like what you initially, your perception of it was.
Yeah. Okay, cool. If I can have an ask, would be consider the perinatal sort of population as well, reproductive age individuals, because we've sort of developed our own, I don't want to call it in-house, but
we would love to
observational type techniques as well.
We would
so
love
I'll give you
that.
some. I'll give you some examples.
That was our next step, is to find a medical professional to view and,
but
and let us know.
Okay, sign me up. You heard it on. Yeah, because so some of the things that we have sort of informally look for are like, what was their entrance to prenatal care? Is it missed appointments?
Absolutely.
Love it.
Is it like delayed care where we really don't know why?
A lot.
And look, I'm basing this. We're basing this off of evidence points, which means, AKA, we've seen it. Yeah. Is there like an individual that seems overly controlling or with them at appointments, and when asked to leave, basically doesn't? We've seen this, and so for us, it's like, well, this is a red flag, right? Withholding sort of. Let's call it withholding treatment, but also withholding information. So individuals won't know their health status, right? They don't know, I don't know if I've had that test. I don't know the results of my labs and these kinds of things. So but this is very much informal, right? I would love to have, and then say, here you go. Here's what I want every perinatal care provider, clinician in Nevada to do. Boom. This is what I want to be part of your, yes. Okay. Awesome.
Love it. Look at you.
Yeah, I know. I wasn't expecting that.
I can feel the passion and
Excited,
excitement.
right? You see that?
That's super tool.
All right, but before we leave sort of this, what is it? Okay, 2 things actually. 2 things. So let's say we do suspect. How do we approach this? What do we do next?
Like we always say, we do it based on the individual. We want to meet the person where they're at, and so we give them options and choices, because they haven't previously had that. So whether that be, would you like resources? Would you like to report? Whichever they're more comfortable doing, that is how we respond.
Okay.
So as law enforcement, we work really closely with all the partners, and especially RISE. And if they say, hey, I'm not ready for a report, but I would like RISE, we back off immediately. And the other thing is we do have hotlines, and I know RISE has a 24/7 hotline, but specifically is if you call that and the person says, just kidding, or I'm not comfortable doing it, I know I was earlier, you follow that. So there are different steps going forward. You just have to meet them where they are. And that's kind of my final takeaway is that piece.
Yeah. And information is empowering. Ultimately, when we're speaking about adults with regards to kind of this, obviously we have to handle cases just like law enforcement does, just like you all, just as us as mandated reporters handle when we have minors involved. Those things sometimes change. But when we think about adults, giving them the information and allowing them to be the experts in their own life and supporting those decisions, regardless of if we think it's best. And also then having conversations opens that up about safety. And at the end of the day, if we can all address the safety of someone, or when a lot of times Jen and I always joke, we've been doing this as advocates for a long time, and even our seasoned advocates will panic when they hear human trafficking. And we're like, you guys have skills, you're an advocate. They're just individuals that may have experienced something that you may not be comfortable with, you may not have a lot of information about, but you can still address them and care for them in such a way that does no harm and can kind of get to the root of that, regardless of if you even touch what they've experienced. They're still human beings. And so for that, it's giving them that option and choice and empowerment and information, and then supporting them in that path, whichever they choose. But then again, assessing safety is always a really good way in, because it shows that you care. It shows that you see the person, even if you know deep down, you're like, I know this exactly is a trafficking case specifically, but they're not ready to disclose. They're not self-identifying. They won't say anything. We can still address those safety things to create a plan for them so that maybe the next time that they do come back to see you all in your care, that may be the time that they're ready. And again, that window of opportunity, you have set them up for success and set your profession up for success. So whether it's you and they now have been moved somewhere else, maybe they're going to disclose that next go around.
Yeah, wonderful. This is much like what we do for all chronic disease management.
Absolutely.
Whether it's substance use, mental health issues, things like diabetes and high blood pressure. Sure. Yeah, great. I love it because it's like, oh, you already know what to do. You've been doing it for something else, so just continue to do it for this. Okay. However, you ready? Oh,
what
go
is
ahead.
RISE, real quick?
Sure.
Thank you. I mean, only because you mentioned it. And then also we have, listeners. And I wanted to make sure, 'cause I know if I don't know, maybe someone else out there.
So RISE is just our acronym for our anti-human trafficking program under Signs of Hope. So we're just basically like the anti-human trafficking department under our larger organization. Our acronym's long. It's Resources and Integration for Survivor Empowerment. But we just say RISE because it's a mouthful.
There it is. All right. Okay. So you told us kind of what to do. Yeah. Can you give us your absolute do nots? Do not do this because you find that it will shut the door. I mean, whatever that looks like. Yeah.
Do not be the hero.
Do not ask unnecessary questions.
Okay. Don't be the hero.
Yeah.
Don't ask unnecessary questions.
I always say be, on the law enforcement side, be the best witness possible.
Yes.
So if you see something going on, I don't expect you to jump in and punch the trafficker in the face. I want you to be the best witness possible. So observing, what are they wearing? What are they looking? What car did they drive away in? Things like that. As this is coming from, I know you said speak on different perspectives, but the public's perspective.
Yeah.
I don't expect anyone to involve themselves in something dangerous.
Okay.
So that's
Okay.
my number one.
That's
on
great.
that.
Okay. What about from health clinician side?
Do not make promises that you can't keep.
Don't make promises.
Love it.
And that means whether it's from you all in your space, whether it's, hey, I promise you I can get you that blanket that you asked for, or I promise that I will be here tomorrow. And maybe then you get sick. And now that person is waiting on you because you built that rapport with them. So setting individuals up for success, being honest and genuine and authentic with them, but setting boundaries when appropriate. If your shift is over or your clinic is closing, you can't change that, but you can set them up for success. We will be closed at this time and we will open at 8 a.m. and someone will call you first thing. That I can guarantee. I will be the one to follow up. Victim service providers, please don't make any promises because we sometimes can't fulfill something.
Of course.
So it's just helping, again, set boundaries, expectations, but again, setting individuals up for success.
Okay. Yeah, along those lines, one of the other ones that we've sort of informally adopted is also don't promise anything along the lines of sort of privacy. No one will ever find out if you tell me because we don't know how that's going to go.
Absolutely.
So whatever. Yeah, that's just kind
smart.
of one of those other informal ones. Okay, you're going to bring us home. What does that look like? What does it look like? Someone has self-identified, we've identified, whatever it is. We've sent the email or called the task force. And this individual is now on the path to, what do you call what's the end? Freedom? What is it? What term do we use?
We like resilience.
Resilience? Okay. What is that? Yeah.
Self-determination, autonomy.
Yeah. What does that look like? Just take us through that ideal case. Someone is being trafficked for multiple reasons. Yeah. And now they're resilient.
I think so. If you've already made the call, because RISE will respond out, usually they are the focal point. They are the main provider and they refer out to any of the resources needed. So recovery support can look like a million different things. So on one path, that person can see 5-6 providers, both inside the task force or outside the task force. So on that road, it could be therapy. It could be going to a shelter. It could be seeking services from you all. It could be medical providers. So on their pathway, we always say the journey is not linear.
Yeah.
Right? I'm sure in your field you say that as well.
Yes.
All the time.
So it's going to be forwards and backwards. And I think success is not measured by the end goal. It's by the little kind of wins that you get along the way. So just for them to just come forward and say, yes, I need help is a success. And we count that.
And like Jhenna mentioned, so we have a whole case management team. Not a very big team, but we have a team. And they work through creating these individualized case plans with our clients. And that is specifically tailored to what their goals are, no matter how big or how small. Sometimes it's, we had one that they had never had a driver's license before. And so it was helping them maybe financially help with a fee for the testing. It was helping them prep for that. It was helping them have a ride to make sure that they got to the appointment on time. It was sitting at the DMV with the individual for that long of a process.
We've had all of this. Look, it's
All
so
of it.
similar. Absolutely.
And so it's something as small as that to obtaining their own housing. Some of our survivors have never filled out an apartment application before. They've never filled out their FAFSA before for student education. And so it's having our staff work alongside whatever their ultimate goal is, whether that is, again, sometimes a longer plan, whether that is we've just kind of engaged with somebody and maybe they're looking to relocate. And so in 2 days, we support them for the 2 days and help them get back to where they feel safest or wherever's home to them and where they feel supportive. And that may be the conclusion of that. It wasn't very long, but it was what they wanted. And now they're safe. And now they're hopefully somewhere that's going to support them further.
Yeah. And thank you, because this is exactly sort of the conversations that we have in the world of medicine. Yeah. Whatever chronic issue I'm sort of treating, I tell everyone that the end game, I'm throwing up air quotes here, looks different for every single person on the face of this planet. A general sort of term that I give individuals is, I want to assist in this whole process. I want it to end with you being at a place where you're living the life that you want to live, or living the life that's worth living. And again, hearing that it's so different for everybody, because oftentimes comparisons happen.
Yes.
In the world of substance use, it's, I have to be 100% abstinent. I have to now be an amazing this and amazing that. And it's like, whoa.
We always say everybody's recovery looks different.
Yes.
Yeah.
Absolutely.
Yeah. Okay. You ready? One last question from each of you. Same question. What is the one thing you want every listener to take away from this conversation?
Yeah, give me a second.
Okay, I'll go first.
Okay.
Perfect. I would like to say that the biggest thing that I always think, even when we do trainings to anyone, is that there's support there for you. It is free. It is 24/7. There is no wait time, wait list. We always answer. You can always speak to someone. Someone can respond to you. Again, within kind of the confounds of how we operate our hotline. But that's our biggest piece, is that, and it's not also just like Jhenna mentioned too, and things, they're not linear. It's not, you've been with us one time and you've exhausted services. What we know is that many of our survivors we engage with multiple times before maybe it's kind of the last time that maybe we're able to support them the best, or that they're ready to engage with us more, or that they had something happen and now they're back again. And so we never want to kind of have a closed door policy to anyone.
Okay. Open door policy.
I think just to piggyback on that, it's the same for Vice. So our Vice team has really done the work and trained and really have an empathetic outlook. So with that, when calling Vice specifically for human trafficking, we will listen to anyone. So if you are a person that suspects trafficking or suspects someone is involved in being exploited, let us know. We don't care what tip it is. They go on every single one. You tell us Elvis is trafficking people in the holes, we'll figure it out. We'll reach out and do it.
Yeah.
I'm telling you, they are great detectives, and they will truly, truly be there for victims and survivors and just the public itself.
Amazing. That's so amazing.
Oh, I'm exhausted.
But
And I haven't done anything.
Do you need any resources?
It's so heavy, but I mean, that's the light at the end of the tunnel, knowing that there is help, that it's not a wait list, because that is also a barrier, waiting for help. I know in recovery, sometimes you have to wait to get into certain programs. It's a process. So knowing that it's kind of just instantaneous is a blessing.
Yeah.
Truly.
All right, Amani.
All right. Well, thank you. Thank you so much, Jhenna and Cassie, for joining us today on our Empowered Voices for this incredibly important and insightful discussion. If you or someone you know are a victim of any form of human trafficking in the Las Vegas area and seeking assistance, please contact RISE program through the Human Trafficking Hotline, 702-936-4001. Las Vegas Metro Police Department Vice line can be reached at 702-828-3455 for tips and reporting human trafficking. We will include this information and additional resources in this episode's show notes.
Yeah, before I sort of close this out, I'm eternally grateful. Thank you for everything that you do, everything that you are, the communities that you're helping, the collaborative teams that you're a part of. I cannot imagine how much effort went into this. You're keeping tons of people alive all the time, all the time. So absolutely critical. Support these efforts in every which way for all of you that are listening and watching. Okay. So we want to acknowledge the tremendous courage of survivors/victims and the dedicated professionals working every day to combat trafficking and support recovery. Your work matters and recovery is possible. Thank you for listening or watching this final episode of Season 3 of Empowered Voices, Recovery to Resiliency. Be sure to subscribe wherever you get your podcasts to access all past and future episodes. Also, don't forget to rate and share with others who may find our information and discussion topics helpful. As always, we encourage you to visit our website, empoweredmoms.org, to share your thoughts on this episode or suggest topics you'd like to hear about on a future episode.
Yes, thank you.
Thank you.
Thank you both. Appreciate you.
If you live in Southern Nevada or in Reno, Carson City, Churchill County, or Lyon County in Northern Nevada, or in Weber County or Davis County in Utah, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance required. Visit empoweredmoms.org for information or to request services. If you live outside of these areas, we encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andrea Peterson and Jason Raw, with production assistance by Rachel Mack. Recorded at the Video Podcast Studio in Las Vegas, Nevada. For information about this podcast and past and future episodes, visit empoweredmoms.org.